Do14 is on the posterior midline, below the spinous process of C7 in a depression.
Gallbladder 21 is located midway between Do14 at the base of C7 and the lateral extremity of the acromion process, but at the crest of the trapezius muscle. To find the crest of the muscle, it may be necessary to dip down slightly to make sure you get the highest part. This point forms a line with Sanjiao 15 and small intestine 13. Gallbladder 21.
Do12 is on the posterior midline, below the spinous process of T3. Do4 is on the posterior midline, below the spinous process of L2. Large intestine 4, you're going to find the length of the second metacarpal bone. So running your finger down, finding the base, making sure that you're not actually on the carpal bones themselves, finding the midpoint of that shaft of bone, coming between the first and second metacarpals, nearer to the second than the first in the muscle.
Large intestine 11 is located at the midpoint between lung 5 and the prominence of the lateral epicondyle of the humerus. Typically, this is at the end of the transverse cubital crease when the arm is fully flexed.
Sanjiao 10 is located 1 sun superior to the tip of the olecranon process of the elbow. The point is found with the arm flexed and the hand supinated. Heart 9 at the radial nail point of the little finger. Going to feel for the flare. Look at where the proximal and radial borders meet. Look at where the nail bed is and put my point in.
Pericardium 8 is found on the palmar aspect of the hand in this nice dip which is proximal to the junction of the heads of the second and third metacarpals. The point is just a little closer to the head of the third metacarpal. Lung 9 is located on the lateral aspect of the wrist flexure, in between the radius, the scaphoid, which is one of the carpal bones, the radial artery, and the tendon of abductor pollicis longus, which is this big tendon that can pull the thumb out. So find the dip between all those three landmarks and the radial artery and mark your point there. Lung 7 is located 1.5 sun proximal to lung 9. It's located just a little lateral to the main line running from lung 9 to lung 5, in a cleft between the tendons of abductor pollicis longus and brachioradialis. It's located just at the base of the flare of the styloid process of the radius. In this position, the point is just about visible on the corner of the arm. If you locate the point too radial, it's falling onto the yang surface of the arm. Bladder 62 is located half a cent inferior to the inferior border of the lateral malleolus. It is located posterior to the peroneal tendons. To bring the peroneal tendons into relief, evert the foot. This is the peroneal tendon here. When the foot is relaxed, the point can then be marked behind it. Gallbladder 39 is located 3 cm superior to the prominence of the lateral malleolus. It's in a groove in between the lateral crest of the fibula and the peroneal tendon. Get your patient to avert their foot against resistance to reveal the peroneal tendon. Be sure to locate this point in the groove between bone and tendon, not posterior to the tendon. Stomach 36 is located approximately 13 cm superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 cm inferior to the inferior border of the patella. Gallbladder 34 is located in a depression which is anterior and inferior to the head of the fibula. To locate the head of the fibula, find the tibial tuberosity and move laterally until you find a prominent bony landmark. Be sure that you don't confuse the head of the fibula with the lateral condyle of the tibia, which is closer to the kneecap. Kidney 6 is located 1 cm directly inferior to the prominence of the medial malleolus. Palpate down 1 cm and feel for a cleft in between 2 tendons. Kidney 6 lies in that cleft. A common mistake is to palpate down only half a cm and to try to locate this point in the ankle joint. It's not in the ankle joint, it's in the cleft between the 2 tendons that are inferior to it. Spleen 6 is located 3 cm superior to the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. Be sure not to place this point actually on the bone. To locate gallbladder 20, palpate up the groove in between the sternocleidomastoid and trapezius muscles. As you get to the base of the occiput, you will find a nice depression. Gallbladder 20 is in the centre of that depression. Extra point supreme yang is located half a cun posterior to the midpoint of a line joining the outer canthus and the lateral extremity of the eyebrow. Make an imaginary line, come halfway, move back half a cun until you're into this fleshy area which is lateral to the lateral orbital margin. Do 20 is located in relation to the midpoint between the glabella and the occiput. Place the heel of your palm on the glabella and the occiput. Fold your fingers around the skull to find the midpoint. Do 20 is located 1 cun posterior to that midpoint. It typically lies in a nice dip. There are several other nice dips slightly further back, which are other dew points, so don't be tempted to go further back than 1 cun posterior to that midpoint.